again, everyone. This is part 2 of my presentation around LGBTQIA plus youth. Again, my name is Miriam Hepler. And to pick up where we start off, once again, as a trigger warning, this slide specifically discusses risk factors for suicide. So if you, again, want to skip forward, feel free. So to pick up where we left off, a study on suicidal thoughts and behaviors found that homelessness, family rejection, living in a rural community, and having unsupportive schools especially placed LGBTQIA plus youth at risk for suicide. I thought it was interesting, specifically it being living in rural communities. I would kind of attest that to multiple things, especially just seclusion, maybe lack of education due to seclusion, and lack of resources, especially. LGBTQIA plus youth who experience parental rejection are 8 times more likely to attempt suicide. Low rates of peer acceptance and increased rates of victimization by peers also places youth at higher risk for suicide or suicidal ideations. As previously mentioned and seen in the graphs, over half of transgender and non-binary youth consider suicide, and they attempt suicide at a higher, it says higher rate. Sorry, it's supposed to say higher rate, not higher rate, so I apologize for that. They attempt and consider suicide at a much higher rate than cisgender peers. LGBTQIA plus youth who have experienced discrimination based on gender identity and sexual orientation within the past 12 months were 2 times more likely to attempt suicide. Considering medical systemic concerns, I wanted to focus on medical concerns because this was a common concern and issue that I found while doing research. So for pediatric LGBTQIA plus training, a study based on medical residents found there were a lot of uncertainty or discomfort referring to on where to refer LGBTQIA plus patients. And these specific areas surrounded mental health, transgender care, support groups, emergency shelter, and familial resources. While all of these are extremely important, I thought emergency shelter really jumped out at me. And I found that to be a great concern as youth may reach out for physical health care and it be in need of emergency shelter for that evening or very soon. So I definitely found that to be extremely concerning because it could just place them at higher risk for homelessness or being returned into an unsafe environment. These residents indicated limited knowledge when it came to puberty blockers or blocking puberty, as well as hormonal and surgical transitioning. So over 70% of these residents felt that they did not have enough knowledge or comfortable with the knowledge that they held in these areas. Residents also overall indicated discomfort in disclosing or discussing sexual orientation, gender identity, and sexual practices. I personally found sexual practices to be extremely interesting, that they were uncomfortable discussing this as things like safe sex and sexual questions are medical concerns. So for that to be such a high discomfort and being one of the top 3 discomforts surrounding LGBTQIA plus care was extremely concerning. Continuing the medical system concerns for LGBTQIA plus care, there was a specific study on the youth's perceptions of their healthcare, and the study aimed to identify areas for improvement by understanding LGBTQIA plus youth's perspective of their primary healthcare. So I thought this was extremely interesting because it's focusing specifically on what the youths identified as their concern. And so The main areas of concern surrounded poor communication, lack of privacy to discuss concerns, disrespectful behavior, and inappropriate behavior towards LGBTQIA plus patients. So surrounding poor communication, patients felt that there were a lot of unanswered questions, that they felt extremely unheard or judged throughout the process. They sensed discomfort or just a standoffish demeanor from physicians when discussing sexual activity or sexual orientation, or they experienced complete negation of sexual orientation altogether. A lot of these youth also mentioned no discussion of birth control or kind of safe sex practices. Surrounding lack of privacy to discuss concerns, many of the youth mentioned that the physicians spoke either to the caregiver rather than to the patient, especially asking questions, or they asked very personal questions in front of caregivers. So that would include things like sexual activity or sexual orientation, which any child or adolescent may be uncomfortable discussing in front of a parent or caregiver. In regard to disrespectful behavior, there were a number of patients that felt talked down to, and then kind of duly mentioned the questions being directed towards caregivers rather than themselves. As for inappropriate behavior towards LGBTQIA plus patients, one patient explained that a doctor had joked about sexually experimenting with animals when the patient revealed that they were pansexual. So whether that was just an ill attempt at a joke, it was completely inappropriate for any medical professional to be making jokes about that. And it could just be pure ignorance on that professional's part as well of not understanding the term pansexual and becoming uncomfortable when that was brought to their attention. Another patient, after disclosing their sexual orientation, had a physician ask if they ever thought about being straight. So that goes back to that first graph where I believe it was over 60% of youth had experienced someone attempting to encourage them to do this exact thing, to reconsider their sexual orientation or gender identity, or felt pressured to kind of revert and kind of undisclose what they had disclosed to this person. As for inappropriate behaviors, they also felt that there is a general disregard for sexuality. And one patient specifically had mentioned, after stating that they were lesbian, the doctor continuously were bringing up birth control options after they repeatedly mentioned that birth control was not on the table for them. And so that can also, again, go back to physician ignorance and not understanding safe sex practices versus birth control. So that alone is just a definite area of needed education for physicians. And then youth also had been denied services based on gender identity or sexual orientation. Continuing the study on the youth's perception, patients, these are suggestions found by the researchers as well as mentioned by the youth for improvements on the specific areas they had mentioned. And so this surrounds completing like a health check with sex-related questions, including like sexual concerns and sexual identity, with the hope to improve that communication and that comfortability discussing sexual activity and sexual orientation with patients, and having patients feel comfortable bringing up those concerns with their physicians. It also eliminates the parent or caregiver having to be in that conversation as well if the youth is filling out that form on their own. Another suggestion is for providers to create educational materials for adolescent patients. And so this, again, would be to create that dialogue and provide resources while improving communication. Another suggestion was to increase confidentiality, and that would be through having private conversations with their adolescent patients and refraining from asking sensitive questions in front of their parent or caregiver. And then also refraining from sharing all information with parents. I know that there are specific laws in different areas about youth's kind of access to confidentiality and medical rights, but having youth be able to express information on information on their person that doesn't put them at a higher risk for any concerning behaviors, and also can be protective in the way of increasing their understanding of safe-sex practices, and discussion of that is extremely important. Another suggestion was to increase respectful behaviors, including increasing physicians' comfortability discussing the sensitive materials, and improving their bedside manner when it comes to specifically LGBTQIA plus youth. And then also having physicians just remain up to date and informed on LGBTQIA plus health-related issues. Concerning positive implications, LGBTQIA plus adolescents experience decreased mental health symptoms, including suicide attempt and ideation, and overall depressive symptoms when engaged in mental health treatment. Suicide risk does reduce by about 40% for youth who have identified having at least one accepting adult. So that goes back to having that safe, affirming space. Suicide risk reduces by about 35% for youth with at least one affirming space, and it decreases at the highest rate for youth with LGBTQIA plus affirming schools, as I had mentioned previously. So this provides overall higher self-esteem, and it has a significant positive impact on overall mental health, especially for schools with LGBTQ plus alliances. Respecting transgender and non-binary youth's pronouns can decrease suicide attempts by about 50% compared to those whose pronouns are not respected. And receiving gender-affirming care, medical and mental health care promotes positive mental health outcomes, including reducing suicide risk. Concerning implications for social workers, I highlighted some micro, meso, macro. Micro, remaining informed, and being comfortable and increasing our comfort, having discussions with all ages, depending on the area we're working in, on sexuality and sexual health. And then a simple way is asking preferred pronouns. Mezzo would be offering parenting courses that focus specifically on mindful parenting for LGBTQIA plus youth. So this would work on developing that comfortability and that communication, and increasing just general knowledge and education for parents. Also providing access to resources. So organizations such as the Trevor Project have a lot of online resources, but just kind of putting that information out there and gathering resources and creating connections with different communal resources for LGBTQIA plus youth. And then in addition, just creating those affirming spaces in our workplaces, in our schools, specifically, and especially for working with youth and adolescents. On the macro level, educating other professionals, so academic and medical professionals especially, and becoming certified to educate on these topics. And we could have CEUs on LGBTQIA plus care, which would be great. And definitely remaining up to date and involved in political works. So currently there's Florida and I think Ohio both now have Don't Say Gay bills, which would restrict public education on sexual orientation and gender identity. So remaining up to date and involved politically, and just active on that front is definitely important. And in conclusion, there has been tremendous growth on the rights movement within the last century, and that has definitely increased inclusivity and knowledge, but definitely continuing to promote societal and systemic changes, especially in healthcare and academic institutions, is extremely important. But I'm running out of time, so I hope that everyone enjoyed. If you have any questions, please feel free to email me. I'm more than happy to send out this presentation, but have a great